Anyone? Oh, you're good? Okay. Oh, hello, Senator Gonzalez. I didn't see you come in. Please. Oh.
Hi, it's so good to see you all today. I'm Senator Gonzalez. I represent Queens, Brooklyn, and Manhattan, and I also chair the Internet and Technology Committee. The intersection of healthcare and AI makes a lot of sense for a member like me, since I represent hospitals like Bellevue and NYU Langone and Hospital Row. We recently did an op-ed actually with NYS to talk about how some of the wealthiest hospital networks in the entire state are investing millions of dollars into artificial intelligence. And this year, we have a $1.5 million proposal in the executive budget to put money into AI in healthcare. And what I'm trying to understand in the context of course, the challenges a lot of unions are facing in negotiating with these wealthy hospital networks for things like safe staffing, what your members believe about AI in healthcare. Because what I'm noticing is these hospitals are trying to move towards automation and outsourcing a lot of patient care. So again, would love to hear from all of you what your members think should happen at the state level.
Sure. From NYS's perspective, I mean, this is a problem that sort of appears across a range of sort of settings. First of all, there's the concern that there's no regulation, and we don't know how accurate these systems are. There's this gold rush mentality where dozens and dozens of companies are putting billions of dollars into creating these tools, and no one really knows how they work, how accurate they are, what kind of biases. There's also the issue in terms of overriding the professional, opinion and autonomy of nurses and other healthcare workers in terms of, you have to follow the program, and that then, steps on their professional judgment. And then finally, there's the workforce effects, right? One area that we're very concerned about is, and this is combined with, there were some comments supporting, for example, interstate compact for nursing is using out-of-state providers in low-wage states to provide, using AI and telehealth to provide healthcare across state lines for New York residents, displacing New York workers and replacing them with low-cost staff from, other states. So there's a whole range of issues, and I think that that's something that really needs to be looked at to make sure that we are not, just sort of opening the door to these investors to just take money out of the system.
I mean, I can say super briefly, I think our members would say sometimes there are functions that they might consider beneficial to help spend more time with patients, not doing notes, et cetera. So there's roles that AI can play. However, it has to be regulated, it has to be overseen. There has to be a strong labor voice in looking at the impacts and what needs to happen.
Thank you. Looking forward to working to bring that labor voice into the conversation.
Thank you.
Thanks.
Assemblywoman